better get started. Welcome everybody on behalf of ExpandNet and the community of practice on scaling development outcomes. I'm extending a warm greetings to you all and welcome to the Health Technical Working Group kicking off the second week of the Community of Practice's 6th annual meeting. With the COP now at least 1,000 strong and growing every day, we're really happy you're here. If you found yourself here, it's probably because you're interested in and committed to scaling up public health interventions in your home country, regionally, or globally, or you're here to engage in cross-sectoral learning, which of course we highly encourage and appreciate. So this working group intentionally brings together diverse representatives from across a wide and growing scaling up community. And it's such an honor for ExpandNet to help lead this working group, since our mission since 2003 has always been to advance the science and the practice of scale up. And we really want your help in continuing to grow and spread the word about bringing more and more scale-minded actors and thinkers to the table. The technical work of many of ExpandNet members in the past has emphasized family planning and reproductive health. And we naturally have many members of the Health Technical Working Group from those areas, but we are also working to expand and transcend the silos of our respective technical areas, so we can really help facilitate comparative learning and experience sharing across different technical areas of public health. So for those of you who with this meeting are new to the community of practice, a special welcome. And to everyone, please consider this an open invitation to engage to the level and depth that you like, because all are welcome. Participation in the COP and all of its working groups is voluntary. All of us are volunteers, and it is free of charge. And the COP's mission is really to professionalize the practice of scaling and to encourage learning across sectors, geographies, and perspectives. So in addition to the annual workshop, the COP issues quarterly newsletters and operates, besides the health, 8 other working groups that explore through the lenses of different sectors and thematic areas. So hopefully you had a chance to participate in some of the prior plenary and working group sessions, but if you haven't, there's still time this week to participate in several events. And registration for all of these events happens at scalingcommunityofpractice.com. And for anyone who missed some of those earlier sessions, MSI will be able to post the recordings, and hopefully you'll be able to take those in later. Personally, I enjoyed moderating the second plenary that focused on mainstreaming a scaling up perspective within donor institutions. And today's session is actually seen as a complement to that one, because in this session, we're exploring the topic of mainstreaming a scaling up mindset within technical institutions and implementing organizations. And we're lucky enough to hear about several organizations who've been doing just that, and they're going to share some of that learning. So first, just some housekeeping remarks. And so the session is being recorded, as I said, it'll be posted later. One can engage in dialogue online at on Twitter using #ScalingCOP. And we encourage that both during today's session, but also throughout the week and beyond. We want to have everybody mute their microphones and turn off their videos. However, this is going to be a dialogue, and later, after our presenters have their remarks, then we will invite others to turn on their videos when they want to contribute. And then the last thing, I want to request and encourage that there could be an active use of the chat area, because for earlier sessions, the chat box has been really a treasure trove of rich input and ideas, and it is going to help serve to try to help set the agenda for the Health Technical Working Group and the Community of Practice over the coming year and two. So please use it vigorously. And if you wish to speak at some point, you can raise your hand so that we can acknowledge. And now it's my pleasure to introduce you to our session moderator, Rebecca Lundgren, who's a longtime colleague and the newest member of the ExpandNet Secretariat. Rebecca is an associate professor for the Center of Gender Equity and Health at the University of California in San Diego. Rebecca is an applied anthropologist with 30 years of experience in implementation science with expertise in family planning, adolescence, social norms, and gender-based violence. As a member of the ExpandNet Secretariat, she is dedicated to advancing the art and science of scaling for social and behavior change programs, with special attention on that transition from pilot to scale up. Rebecca currently leads implementation science initiatives, including Passages, which is a USAID-funded project designed to bridge the gap between science and policy and practice, using research, technical assistance, and catalytic support on norms shifting. And that's focused on adolescent sexual and reproductive health interventions. She's also collaborating to apply systems-based scale-up approaches to adolescent sexual and reproductive health and violence prevention interventions in Uganda, Kenya, Niger, and the Democratic Republic of Congo. Since 2017, she's advising on the Inspire package of strategies to prevent violence against children, including developing tools and guides for scale-up and adaptation. Many of you know Rebecca from her many years of work at Georgetown University's Institute for Reproductive Health, and earlier than that, the Population Council. So I'm really pleased to hand you over to Rebecca now. Thank you for coming and thank you for being with us. Rebecca, please.
Thanks. Good morning, everybody. Thanks, Laura, for that very nice introduction. I'm really happy to be here with my colleagues here on the panel and all of you. I see a lot of friends and other folks who've joined us on the scale-up journey over the last, 15 years or so. So our panel today, our whole day today really is talking about changing the way that we do business, changing the way we look at development in terms of infusing an idea about scale-up and sustainability throughout all of our work. So today we're talking not just about how we do our projects and our activities and our programs on the ground, but how we do work together as an organization and what we can do in our own organizations and our own perspectives to make sure that we keep infusing a scale-up perspective throughout our work. So on our panel today, we're going to start with a panel. You can see my three esteemed colleagues here who are going to speak. I'll introduce them in a moment. They'll have a few remarks. We'll have some questions. We'll do that for about a half an hour. Then we're going to open up the floor to some other colleagues who have really interesting reflections on where their scale-up journey has taken them. Then we will open up to a lively discussion. So with all of you. So please do feel free to share comments, ideas, questions in the chat starting now. And I think we have plenty of time for a lively debate. So I'm going to start out by introducing Callie Simon. Callie is the Adolescent Sexual and Reproductive Health Senior Advisor and Team Lead at Save the Children. She has 15 years of experience in adolescent sexual and reproductive health and gender, and has designed and supported technical strategies leading adolescent health across a number of countries. She's also worked very closely with applying the ExpandNet framework to guide scale-up of a number of ASRH interventions. Callie, as some of you know, also has experience working with Pathfinder International and also CARE, USAID, and also served as a Peace Corps volunteer. So really happy to have Callie here. And also joining Callie is David Leahy. He's the Senior Director of Impact, Learning, Knowledge, and Accountability at CARE USA. So David's been in that role since 2019. He leads CARE strategy to really enhance its systems for evidence-based decision-making and program quality. He has over 30 years of experience in international development in a range of roles, and is also an adjunct lecturer at a number of universities. And our next panelist is Olayinka Umar Farouk. She is a senior technical advisor in RNMNCH plus nutrition at Breakthrough Action in Abuja, Nigeria. So Olayinka has a broad experience across different sectors. She's worked in the public, private, and non-for-profit sectors across a number of technical areas from healthcare management, policy, advocacy, and integrated health. Also focusing on service delivery, access, and behavioral change. She's worked on a number of projects funded by USAID, Bill and Melinda Gates Foundation, and others. And she's going to share with us some of her experiences providing technical assistance to government implementation partners and others. So we know Olayinka as a passionate advocate for a shift in the way we're looking at scale up, as all of us here on this panel are, and many of you also out there are too. So with that, introduce of my esteemed colleagues, I think we're going to turn to David first and ask him to talk a little bit about his experience at CARE. We know that CARE has been doing a lot of deep thinking on how to adopt processes and systems for greater impact at scale. He has a new document I think he might talk to us about, and some really interesting experiences. So my question to you, David, is, frame a little bit of the work that you've been doing at CARE and this sort of transition in the way you go about your work, but also tell us, what are some of your lessons learned that you have from shifting this perspective on CARE's role in scaling? Over to you.
Thanks, Rebecca, and good morning, good afternoon, good evening to everyone. It's great to be here. As a large legacy international NGO, CARE has had what we call impact at scale as one of our ambitions for a number of years. And it recently became an explicit part of CARE's 2030 strategy and is now being resourced with the staffing and high-level attention and funding that's really needed to do this work. Scale for CARE is achieving sustainable systemic change through external pathways beyond CARE and partners' direct work with communities. And I think that's a key point right there, actually, to keep in mind, to deliver accelerated and gender equitable growth of impact. We want the gender equitable solutions to scale exponentially, not incrementally, so they lead to impact for the majority of the target population affected by a particular problem, rather than just small numbers that we can support through CARE and partners' direct footprint. So we've recently adopted CARE's or IDIA's six-stage process that starts with ideation, moves on to research and development and proof of concept, and then only after all that to a transition to scaling and what we call sustainable scale. We put a particular emphasis on rapid experimentation and learning, generating evidence, and refining models alongside partners. Some of the pathways that we use to enable scaling include advocacy, market-based approaches, system strengthening, and social accountability, social norms change, and social movements. Interestingly, scaling can potentially help to decolonize aid as it elevates the role of local partners and reduces dependence on donor grant funding. So that said, while scaling may on the surface be attractive because it demonstrates that the organization is influential and innovative, actually putting it into practice may feel like an existential threat for some people, and I'll explain why. Ultimately, what's most important is increasing our impact sustainably at the systems level, going beyond the pilots and the small boutique projects that often just remain at the community level and are very often dependent on the next phase of grant funding. It's not enough for CARE and others to keep replicating its best models with new funding and new geographies. That's kind of what a lot of people felt about scaling before, is let's just replicate what we do well, what we have evidence of success with, and look for new funding to do it in more places. In fact, direct service delivery by an international NGO, it can have impact, and it does allow for learning and innovation, but on its own, it will never be sustainable. So what do we need to do? What do we need to change? What's most important, I think, is closely associating our scaling efforts with government, private sector, and civil society organizations like social movements, who can eventually become the doer and the payer at scale. I think many of us are familiar with that article from a few years ago in the Stanford Social Innovation Review on that, and really emphasizing this systems level impact. So what does that mean for CARE's role? What we do then is our role becomes one of systems orchestration with catalytic impact. Those are nice words, right? I'm going to explain. So what is systems orchestration? For CARE, it means supporting systems actors to ensure that all are working in unison to deliver a proven solution at optimum fidelity to development challenges faced by vulnerable populations. This can mean convening and connecting systems actors with each other, strengthening capacity, generating and disseminating evidence, business planning, advocating with donors, identifying and overcoming barriers, changing policies, and facilitating their implementation in practice. Catalytic impact is when CARE is no longer providing services directly, but rather refers to the impact of solutions implemented by other actors that CARE has influenced through its systems orchestration work. So this is how I see CARE's role changing as we move forward with impact at scale.
Thank you, David. That's really a lot of food for thought. I've noted a few things we can follow up on in the discussion. Now, let me turn to Callie. So I'm very familiar with SAVE's work. You've been at the forefront of a number of ASRH interventions and working on scaling them up throughout your programs globally. I'd like you to talk to us a little bit about your experiences, some of the facilitating factors you found, what's really worked for you, what are some of the challenges, and what learnings you can share with others of us who are also working in this area.
Great. Thank you so much, Rebecca. And thanks so much for having me here. It's really a pleasure, and it's so exciting to talk about our work in this space. So globally, Save the Children is guided by our theory of change, which, sort of similar to what David was saying, articulates very clearly that the end goal of our work is scale up and meaningfully shifting power to partners, communities, and children as a top priority. Within that context, our adolescent sexual and reproductive health team, which is the team I work on, has focused on operationalizing a scale-up mindset and scale-up processes within our programming. And I'll speak to that body of work very specifically today. I want to extend my gratitude to colleagues, particularly Melanie Yanner and Jennifer Gales, who may be on the call today, who I spoke with to prepare for this session. So this reflects more than just my own personal viewpoints. Within our adolescent sexual and reproductive health portfolio and our gender work, we really started to shift our focus to scale up in the first decade of the 2000s. We were no longer content with the focus on pilots with very limited pathways for sustainable scale up that seemed to be the status quo within the field of adolescent sexual and reproductive health. Since then, we have tried to intentionally design with scale up in mind from day one, use adaptation and learning processes to further align ASRH approaches with the health systems and community systems where we're working, with the ultimate goal of institutionalizing those evidence-based approaches within government and community and local partner systems. So to say kind of what David was saying, moving away from SAVE being the doer to being the facilitator. A few examples of this work, which many of you on this call have been engaged in, is the Pragati Approach, which is a game-based approach to address family planning and reproductive health, which is now institutionalized in tools used by CHWs across Nepal. Growing Up Great in the DRC, which is a school and community-based approach for very young adolescents, which is in the final years of grant funding, already institutionalized in government policies and work plans, but looking for sustainable funding. And more recently, efforts to identify scalable innovations that would improve postpartum family planning for adolescent moms and first-time parents that can be embedded within health systems, looking specifically at Bangladesh and Tanzania for that work. As I mentioned, many of you on this call and Rebecca and others have been engaged in this work, and we appreciate that partnership. Looking across those efforts, I noted 3 key facilitators of operationalizing a scale-up mindset within Save the Children and within our work. First is that it has been really, really important for us to use a framework for scale-up that gives us a common vocabulary. It has clear recommended steps in the process. It includes checklists and examples of scalable innovations and scale-up plans. And in our programs, perhaps no surprise, we've used the ExpandNet framework to do this. It's It's been immensely helpful in making sure we're all on the same page and looking at the same objectives. Second, we have found that we have to change what success looks like. That's for our organizations, for ourselves, for our teams. We have to move from success being that Save the Children implemented with quality and achieved impact, which is what we maybe traditionally see as success in programming, to success being that Save the Children has facilitated that the government and local partners can own and continue implementing the approach and the innovation, quite frankly, without us over time. Finally, we've had to get really practical. What I mean by that is that we, from day one, have to make sure that any step in the scale-up process, whether it be the initial testing within a scale-up mindset, the ongoing engagement of stakeholders to ensure their participation in design, implementation, and ownership, repeated moments and tech checkpoints for adaptation and learning, has to be in the budget. It has to be in the work plan. It has to be owned by somebody so that they have responsibility, and it has to be counted in the MEL plan. What this means is that we have to make sure that we aren't just assuming scale up is going to happen by magic, but that we are actually planning for and ensuring that those steps take place across the life of the initial funding for the investment. We're really proud of our work on trying to operationalize a scale-up mindset in our adolescent sexual and reproductive health and gender programming, but we know we have a long way to go, and so I'm really looking forward to learning from the rest of you today as we discuss how we can do this collectively. Thanks, Rebecca.
Thanks, Callie. I noted down a lot of food for thought there that we can dig into later. But first, I'd like to welcome Olayinka to talk a little bit about her experiences. She has some interesting perspectives because she's going to talk to us about Scale Up from two different organizational lenses, both her work on MCSP and Breakthrough Action. So our question to you, Olayinka, is what is your what advice do you have on us on how to facilitate an effective organizational focus on Scale Up?
Thank you so much, Rebecca, and nice being on the panel with Callie and David as well. So I'm going to start with a little story, and because I work in social and behavior change, and storytelling is one of those things that we use to communicate. I think around this time, like 8 years ago, I met with Dr. Nosauro Baton. That day was also my birthday, just like today. And I'd come in earlier for an interview for a role that was called the National Exceeding Coordinator. But he couldn't make the interview in the morning, and I was asked to come back in the afternoon to have a chat with him. And that began my journey into what we call the pilot or introduction before we went to scale. Many people know me as Olayinka Clear-Exceeding or Olayinka CHX. It's a name that has kind of like followed me up till today. So that was back in 2013. The government of Nigeria had prioritized the, we had 15 UN Commission life-saving commodities, and as a project, the Targeted State High Impact Project was introducing the use of chlorhexidine twined with the use of misoprostol for the prevention of postpartum hemorrhage. And after I had the interview that day, the following week I resumed, and the following week I was at the formal launch in Bauchi, one of the pilot states where we had these interventions. Under the Chief project, our goal really was to demonstrate that chlorhexidine could be used in country. And so we did an implementation research that led to providing the needed resources or guidance for a policy direction. So by 2016, with our implementation research and other work, we had moved from 2 states with additional funding from Bill and Melinda Gates to 2 other states. So by the time the project was closing in 2015, we had learnings from 4 states. And these learnings, alongside learnings from other partners like CHAI, who were implementing in 3 states, provided the needed framework for the government to decide to scale up the use of chlorhexidine. So in Nigeria, it's just not about the fact that there's global evidence. They always need to have local evidence as well for any intervention to move from pilot to scale. Aside that, through my years of moving from one project to another, we had some key focus really working in different aspects of the scale up, because one of the key things when we look at the definition of scale up is really around deliberate effort. I think that keeps on standing out for me. When we look at ExpandNet's definition of scale up, deliberate effort to increase the impact of health services, innovation successfully tested in pilot or experimental projects so as to benefit more people and to foster policy and program development on a lasting basis. With this guiding us, we focused on making sure the necessary policies were in place. So aside having a scale-up strategy, we worked with the local manufacturers to make sure that there was availability of the commodity or the drug in country. We worked with other government agencies like the regulatory bodies for the drugs to make sure those local manufacturers are accredited. We worked with the government agency responsible for listing drugs on the essential medicine list. So we approached the whole, we've been deliberate in our approach to scaling up. Having said this, working with other partners to make sure that the National Demographic Health Survey could also carry an indicator to let us know the progress the country was making sure that the monitoring and evaluation systems in country carried an indicator to see if children at birth got the use of chlorhexidine. Long story short, by the time the next National Demographic Health Survey was coming out, Nigeria from zero, we had 11% use of chlorhexidine in Nigeria by 2018. So I'll now go back to what Rebecca was asking me about. So what were the key learnings from me having transitioned from different projects to and also moving an intervention from introduction to scale? One of the key, I have 6 key learnings. First one is a shared vision. So as an organization, you may have your vision of what you want to do, but if the vision is not shared by others in terms of who you're working with, so that was the government of Nigeria at national level. And so that vision needs to be shared by, even if you have that as an organization, it needs to be shared by others that were going to support the work. My second key learning is there must be drivers, not just one person. So you can be the driver within your organization, but there needs to be a driver within government, and that's ownership, government taking the wheel. So for specifically for scaling up chlorhexidine work that I worked on over 2 projects, I was there. Then I also had another mentor within the Federal Ministry of Health, Dr. Bose Adeniro. So from the work from T-SHIP to the work at MCSP, she was at the driver's seat and at the government side and made sure that things were working. The third angle is of my learnings is collaboration and partnership. As a project or an organization, you definitely can't address all the key areas of a scale-up. Either your project restricts you, it's not your mandate, but you need to definitely collaborate and have partnerships. So there were other projects or organizations also working in the same space, and we needed to find a way to collaborate, again, have a shared vision. And so working closely with organizations like CHICE, Save the Children, were some of the key partnerships for the scale-up effort. My fourth key learning, and I really don't know how to put it in a bucket, it's really on, I wouldn't say if I should call it walk the talk. So there's a difference in when you do understand that this intervention works or has worked, but to actually having that lived experience, it gives another level of trust or to when you promote this commodity or drugs. So I give for example, for me, in 2014, when we had the first chlorhexidine locally made in Nigeria, I just had a child then, and so I got to use chlorhexidine on her, and I saw how impactful that was, and I was able to talk through it from my experience. In 2016, I had another child and I used clexidine, but unfortunately, my child came down with neonatal sepsis. This was the same thing that clexidine was supposed to prevent, and you are the driver's seat of driving an intervention, but the intervention failed. And it took a while to say, okay, what happened here? It was also a key learning because, again, you really need to address the fears of your intervention. Not everything is 100%. There will definitely be failures. And for you to address that head on was really, really important. And for me, it was initially those first few weeks was a bit devastating, but I took action and I tried to find out why. So things like, returning the batch, getting to the manufacturer, okay, can you check this batch for me? What has happened? Because my child came down with sepsis. But it was also key learning for me that if you're going to do anything regards newborn intervention in Nigeria, you must never forget mothers-in-law. They remain a key target audience for you. So that was my fourth learning. My fifth learning is for any scale up, you need to have a target audience. What exactly are you scaling up and who exactly are you targeting this at? We also need to have at the back of our mind that there's a need to iterate and change focus as it is. So if I roll back and reflect back at the experience over TSHIP, MCSP, our target audience had always been the national government. And we were able to achieve all we had set out to do at national level. But then the project ended and there was a need to move to your next target audience, which could either be either the subnational level or you focus on a particular target audience, maybe the tertiary institutions, and say, okay, so we're going to focus on this group of people next, then move on to the next. And my last point of key learning is scale up takes time. And it's just a 5-year project definitely will not lead to the scale up of a health intervention or a project. Over to you, Rebecca.
Those are so great, Olenka. I feel like I should write those on a poster and put them up in my office. And your last question about scaling up takes time is one that I think we're all really grappling with. So maybe I would like to ask Callie and David to remark a little bit about that. How does your organization grapple with integrating a scale-up perspective within short-term donor-funded projects? Do you have any thoughts or advice for us on that issue?
David, do you want to go first?
Sure. Well, I just put a comment in the chat that I think speaks to this a little bit, and that is that right now we're really focused on a limited set of solutions that we are advancing through this 6-stage IDIA process. But what we're trying to do is be much more intentional about including scaling pathways in actual project design. And those pathways could be advocacy, market-based approaches, system strengthening, et cetera, as well as a hypothesis of sustainable scale. That is eventual adoption by governments, private sector, or open replication by civil society groups. So it's kind of a mix of the solutions that are sort of ready to scale now based on long practice, and I think the most obvious one is the Village Savings and Loan Associations that CARE's worked with for many years. But we're also doing a lot to ready the community scorecard for scaling much more massively than has currently been the case. And then, being much more intentional about our design, mainstreaming, if you will, for the future. That said, there is a need for donor funding in those earlier stages. And it's hard, if the donor is focused on something quite different, you need to influence that somehow with the evidence that you have.
Yeah, thanks, David. I think that refers back to the panel last week, which was on donor perspectives. Callie, do you have something you'd like to add, other lessons learned?
Yeah, I think I could pick up what David left off. Similarly, Save the Children has a set of key common approaches that we are looking to scale across our portfolio. And the way that we grapple with the inevitable short-term donor funding that many of us operate within is by really intentionally trying to piece together the donor funding over time to create that pathway to scale. So what I mean by that is we get an investment from a donor to say either pilot or innovate or test an approach. But we immediately say, okay, so what is the end goal here, right? The end goal is if this is successful, it is owned by and sustained by key actors within a country, whether that be the government or local partners. And so we design with that in mind from day one. So we're designing a scalable approach, we're testing a scalable approach, and then we're immediately seeking to understand how can we piece together different donor funding streams across the life cycle of this approach so that we can ultimately get to scale. So some donor funding might go for piloting and testing. Some donor funding might bridge from a pilot to a testing to actually providing the capacity development and the technical assistance to partners. Some donor funding might be able to be used to then document and learn from that so that we can facilitate broader scale up, and working across kind of making sure that we have that beginning plan, and then frankly, trying to be very creative and piecing together donor funding to try to make that long scale trajectory happen has been what we've done. I mean, a good example is, and Rebecca's collaborated on this in DRC, where we started with some, Gates and USAID funding, brought in some Canadian funding, and continuing to try to figure out how to piece it together. And ultimately, of course, finding sustainable funding for the partners in country to do that work, which is a tricky, complex part of scale, of course, but part of the picture.
Yeah, I think that's a really interesting point you raised, Callie, is that I think as we're kind of traveling down this road, it's not so much focusing on one donor. I'm seeing a lot more focus on different donors working together, and how we're similarly in working together, we're doing with Save the Children in Niger, where we're piecing together different donors and trying to expect that this will not be something that's funded by only one donor. So I think a lot of really important thoughts there that you're all kind of saying in terms of really intentional design on scale up from the beginning, making sure you have a theory of change, scale up objectives, the idea that you really have to be realistic and simple and design your interventions for scale, and then also thinking about the sort of system in which the donors are supporting it, and others, not just donors. So I want to turn to something a little bit different. Partially because this is really close to my heart and I get to do it because I'm a moderator. I would like to talk a little bit about the organizational norms that support scale up. So for each of you in your organizations, what are some of the norms, structures, and processes that either really support all of these things, great ideas you've been sharing with us, and some that maybe are barriers that you need to address to really infuse the scale up perspective in all of your work? So any of the three of you can take that question first. And then after this, I think we'll open it up to a few others that I know would like to share about scale up. So organizational norms and structures that support or constrain scale up.
Well, I can go ahead and jump in on this one. So I think one of the easiest things that CARE figured out, as we were developing our processes for scaling, was the focus on gender transformation. As most of you who know CARE are well aware, that's really central to our work. And I think what many felt is that we've had a lot of great success on a small scale with a lot of the gender transformative work, but really to make a difference, we need to figure out how to scale that up, through social norms change, for example. We've had a lot of discussions with you, Rebecca, about that in particular, as well as social movements. So that's been great, but there have been many challenges too. I'll be honest, sometimes program teams have very different visions for scaling. Some may be more focused on continuing to fundraise for expanded service delivery. Some may also be wary of handing service delivery over to partners, feeling that somehow impact could be lost this way. And as I alluded to earlier, some may even feel threatened that their jobs could become unnecessary or expendable if partners are leading scaling efforts. Our traditional country office structures and staffing may also be more aligned with service delivery than with scaling and innovation per se. So greater agility is needed to adapt to the changing roles that need to be more focused on partnership and influencing. And then even on the marketing and fundraising side, they also may have a very different understanding of the intervention that you're scaling, and they may be pitching a different image of what you're trying to achieve. So they need to also be very much on the same page as program staff, and that includes a willingness to highlight the work of partners. And that may sometimes challenge the traditional narrative of development assistance as charity that often appeals to many donors. I'll stop there.
Thanks, David. Those are really interesting and food for thoughts, and kind of go back to your discussion earlier about threats, about people, sometimes organizations or individuals can see the scale-up focus as a threat to their, viability and role moving forward. Olayinka, would you like to comment on this a little bit in terms of your perspective of within the organizations that you've worked with? What kind of internal norms and structures can support some of those great lessons that you shared with us?
So just like Callie mentioned, it's really as you plan to do any scale up. And one of the things is choosing the audience for us. So on Breakthrough Action, we're clear on if we're scaling up this intervention and working at the lower level, so at the community level, and from the beginning, making the community leaders understand and changing their own perspective. So we're doing what we call a community capacity approach, whereby from the onset we are not coming in with attempting to fund any of the activities. So giving the community the ownership from the onset, and so trying it out in a small scale, then moving in gradually and rewarding them for taking care of their community. So we've seen a huge shift in this approach, whereby we are looking at, so we've learned over the years that when you want to scale up and hand over to government is a bit challenging. So we're trying this new approach of community ownership from the onset. And we're seeing where communities are coming together and addressing their own needs. And when they do this, we also created what we call a competition and even shared learning amongst them. So they do some peer learning. So if we see a community doing so well, you go to the next community and help them to bring it up. That's one of the ways that we're approaching this. And just like David said, also internally, on the whole concept around scale up is a bit challenging for most people to kind of grasp, understand. And so it's a challenging field for most people. So the community of practice is really a great place for people to come and learn and engage. So internally, it's challenging for this. And also the other challenge is sometimes the lower level government feel like, okay, you have left them behind and you have moved straight to the community. So you try to kind of bridge the gap and say, okay, it's a community that makes up the people at the higher level. So to the extent that you can get more communities involved, and also make sure that you are carrying the necessary government stakeholders along the process, kind of helps that to address that. So carry the government along, but focus should be on community ownership. It's one of the ways. Thank you.
Thank you. Really great reflections around ownership and bringing the community in. Callie, is there anything you'd like to add before we open up to other speakers? Any thoughts you have on that point, on this point of organizational change and norms?
I think I'll just add one. I agree with everything that's been said. I think one of the things that we've struggled with is not only norms, but processes. So scale up requires a lot of adaptation as you go. You have to be really, really willing to throw out things that aren't working, that don't align with systems. You have to be willing to continuously change your plans. And Save the Children and many other organizations that I've worked for have systems that are not inherently open to rapid changes because they've been designed to deliver compliant projects on time, on budget, on work plan, designed, 5 years before the project, is at the end point. So I think having to really work within robust and rigorous systems of compliance and budget and work planning has been tricky for us, and something that we've worked really hard to deal with, which often means getting very high level buy-in to change some of those systems, and in some cases make rapid adaptations to the systems themselves. So I think that's maybe a bit more about processes than norms, but relevant and applicable to lots of big organizations.
Yeah, that's great, Callie. I think that's really important. And in terms of those processes, the more rigid processes you have, how does that support scale up? I think that's really an interesting perspective. And then you're also introducing the topic of adaptive management, responsive feedback, and how important that is to scale up, which is a whole other topic I think we could discuss. So first I wanted to say there's some really great conversation going in the chat box. So maybe especially my 3 panelists could engage with that as we go forward, because I do want to open up the conversation to other colleagues who I know are eager to share their experiences. So I'm going to do that now, and then we'll come back to kind of a broader discussion of, if we have time, some more points that you've raised and that we have kind of slotted as important things to discuss today. So I think I'll pass. I'm not sure who wants to speak first. I think Olivier from Tearfund, are you here? Would you like to say a few words on your perspective of incorporating scale-up mindset and processes within your organization? I see you are here, Olivier. Thanks. Go ahead. Over to you.
Yeah, thanks. Good morning, good afternoon, good evening to everyone. I'm Olivier Wiziman, working for Tearfund Rwanda, and we've been implementing Passages, which is a USAID funding project. And some of the things I'd like to share today, for those who don't know what we've been doing, let me just run through what we've been doing. So we've been implementing Passages in 2 countries, and we used an intervention called Masculinity, Faith, and Family and Faith, which is an adaptation of Tearfund evidence-based norm-shifting intervention, transform masculinity. So we did this in 2 countries, which is in DRC, Congo, and in Rwanda. Let me just take you through quickly what it's all about. So the core component of transform masculinity, which is there for MFF, are faith leaders, training and engagement, gender champions, and community dialogues. Those are the core pillars of MFF, those 3: faith leaders, training, and engagement. So if I'm to talk about how did we deal with it internally to advance or mainstream the scale-up mindset, for us it was very important to first define what is and what is not scalable, which is very important in our context. And secondly was to find key stakeholders who are in line with the objectives, especially when talking about social norms. So we had even to contextualize the MFF using our resources. So some of the opportunities or advantages was to use our resources, Tearfund resources, alongside ROH, which is Institute for Reproductive Health, Georgetown University. And the scale-up pathways, we also used social accountability, which was very important, and also disseminating evidence from DRC. For your records, so for DRC, we did a scale up from 2016 to 2020. And in Rwanda, we did a pilot and scale up from 2020, and we just finished the project in 2021. So this means another element for us that was very determinant was COVID-19. So it exposed the vulnerability, and we had to intervene. So there was a need of scale up based on the cases of HGBV that were skyrocketing in our communities. So it played both roles, COVID-19, because we started the project in 2020, right in Jan 2020, and up to June 2021. And also it was very important was for us for scale up pathways was to first develop a framework for scale up, which had specific objectives and milestones. Another element that was very important for Tearfund was also to to work with churches and faith leaders. Just to highlight that faith leaders can be both an advantage or an ally, or at the same time a challenge to work with, or bottleneck. So for us, it was very important to work with the faith leaders who understood the needs of social norm shifting. So we targeted influential denominational leaders at national level. So we empowered them so that they can support both gender champions who afterward were the ones to conduct the community dialogues. So for the scale up pathways that I would like to also to highlight was that we have to very identify what is scalable and not scalable in our context. And also adaptation or inclusion of new elements should be carefully considered. As one of my colleagues said, we have to be flexible. Things are over-changing. So, but having a framework and a theory of change really helped us as a roadmap for us. So that was it for TIAF and Rwanda, to understand where we are going for scale up. And we are able to also make the scale up into existing departments, which was very important. In DRC, we did with ECC, which is the Church of Christ in Congo. We did the scale up into 4 departments. In Rwanda, we also did a scale up into existing department, but which was in line with objectives of MFF, as I explained earlier, which is masculinity, family, and faith. In Rwanda, we did in the Department of Sexual Reproductive Health with one of our implementing partners. And we also did the church and community transformation with another implementing partner. So why did we choose this? We saw that there was sustainability and ownership of the faith leaders. And also for the institutionalization of the MFF, we had to identify key influential positions within those implementing partners.
Olivia,
yeah.
I'm sorry, can we just wrap up now so I can, and then you can continue maybe sharing more details in the chat if you'd like?
Thank you so much. So yeah. My time is over. That's what I had to share. Thank you so much.
Thank you, Olivia. And feel free to add more in the chat if you'd like. We're hearing again from Olivia the importance of a scaling up framework. I think that's definitely a theme that everyone is sharing today. I think I'd like to go maybe to FHI 360. Kristen, are you here with us? Yes, could you share a little bit of your perspective?
Yes. Hello, everyone. Thank you, Rebecca. I'm Kirsten Krueger. I'm a technical advisor in research utilization at FHI 360, and I'm based in our North Carolina office. I've been part of our research utilization group from its inception 20 years ago. And the whole thrust of our group is scaling up evidenced, underused innovations and interventions. I've worked primarily with this group in family planning, but we now work across all sectors with the framework and the idea that scaling up some of those aspects are agnostic. It doesn't need to be specific to a particular sector. But one of the things I wanted to share about institutionalizing that work at FHI 360, a couple things come to mind. One, some of you may know that FHI 360 has a big research component to our organization. And we also have a big programs component. And we have since the inception, worked to ensure that the research we do gets picked up and used, and that the programs that we design and implement are based on evidence. And working, of course, through, controversial to emerging to promising to standard of practice, and the scale up involved in all of that. So in our beginnings, we actually were doing this work. We just didn't call it scale up or research utilization. We didn't have a specific unit within the organization, but in 2001, we did start a deliberate, dedicated unit, started with 2 people, and now I think we have 24 or so. And we were able to kind of make that launch of a deliberate and specific group of experts that was growing through the efforts and interest of our donors at USAID, who actually asked us to formalize something and help create a model and help create framework and strategies for moving evidence into programs and policies. So that was a really big key for bringing about this aspect in our work, was actually having a donor ask for it and also help support it. And I will say that it continues internally, it continues to be a challenge to get our work related to scale up included in our research and in programs. And part of that is because it can be amorphous, and a lot of people do the work of helping to scale up. So sometimes we come across the barriers of like, well, why do we need you, or what's so special about what you do, or why can't I do that work? And for sure, a lot of people can do the work and do the work. And even though we're a group of 20-some, there are hundreds, thousands of people in the organization who do the work. Maybe they're calling it something else, and maybe they don't identify themselves as a scale-up specialist or a research utilization specialist. I think sort of riffing off of what Callie and Rebecca were talking about with the practicalities of institutionalization, I know intimately, because I was working on it, how we grew inside the organization. And it was literally doing what we called road shows and presentations and internally and externally with partners to say, hey, this is what the science says about how much evidence is actually getting used. And this is how long the gap is between the no-do. And so it was a lot of awareness creation and talking to people and pointing out what we know, and that there are diffusion theories and strategies and experts. So it really was an awareness building thing. We also internally had some wins when we were able to bring it into our orientation for new staff. And strangely, these are very mundane, but they were giant successes when we would get, we finally got the checkbox that said, have you talked to the research utilization group, for both proposals when we were looking to bring in new work, and also for research protocols. And that is a standard of practice for us now. We didn't have it, and it took years to get those tiny things, but now they are institutionalized, and you can't pass go without having that input from us.
Thank you, Kirsten.
Yeah, perfect.
I really enjoyed your very practical sort of explanation of the things that have to be in place to make sure scale up is institutionalized within your organization. I think you've given a really kind of very, like I said, very practical reflections on that. So thank you for that. I would like to move on. I think we have a couple other people who'd like to speak. So feel free to share any other thoughts you have in the chat box. And I think I would like to turn it over to Megan at A360. Megan, are you prepared to say a few remarks about what you've learned organizationally about Scale Up?
Yes, thanks, Rebecca. I was nodding enthusiastically, I think, at a lot of the panelists and the other speakers who are sharing, because I think a lot of our lessons under A360 are pretty similar. So for those of you in the room who might not be familiar with Adolescent 360, or A360 for short, was an investment from the Gates Foundation and the Children's Investment Fund Foundation. began in 2016, worked to design adolescent SRH interventions across 3 countries, Ethiopia, Nigeria, and Tanzania. So in 2016, we began with a pretty intensive design process, which took 2 years, so quite a long time. We began implementation in 2018, and during those early phases, we made an intentional decision that we wanted to be working directly through government health structures, kind of making strategic decision that was going to be the most effective avenue for sustainable scale for us as a program. So a lot of the learning that I would share is focused on scale through the public sector. And as we began that early implementation and intensive adaptive implementation processes, one of the things that we really tried to do is to expand our definition of program user so that we thought not just about what was desirable for girls in our intervention, but also what would resonate with frontline health workers. We knew that our scale up would fundamentally fail if if our interventions didn't also respond to the experiences and constraints of those public sector actors. So, we reflected a lot, as Callie mentioned in her presentation, on the necessity of incorporating the sustainable scale mindset from the outset of design. And certainly, we're still working through how to balance, design for both the end users and for the health systems, and it's not straightforward. But we've been exploring that kind of intentional focus on scale from the outset in subsequent design processes that we've been undertaking. And as we approached the end of that first phase of our program in 2019 and began to discuss the potential for follow-on funding with our donors, we knew that this follow-on investment would focus further on scaling our interventions and really institutionalizing them into government systems as a means of sustainable scale. So we did some intensive work with our teams in those early phases of designing that follow-on to make sure that we had a really clear approach to scale up and institutionalization outlined that was also context specific. So this included, working through a brief on how we define sustainability, the creation of a tool for monitoring progress towards institutionalization. This drew heavily on the ExpandNet framework, as Callie also mentioned, and we took that, tool and framework and we tested and validated it across our country programs, which I think was a useful exercise. And all this was done in the lead up to that co-creation process for the follow-on investment. And we knew we wanted to begin that follow-up phase even from conceptualization with a solid grounding in the evidence around sustainable scale. And so, as we went into this, A3C is a bit unique in that we had this kind of long co-creation process with our donors on our follow-on. And Laura was kind enough to give an overview of the evidence that ExpandNet has generated and consolidated during those global co-creation workshops for our follow-on. And this was really key because those moments included not just our internal project team, but also, our donors. And so having them in the room, so we were able to have that same sort of grounding, supported us to create manageable and evidence-based expectations. And that global co-creation moment was also cascaded to the country level, country level co-creation workshops where government actors were also present in those moments to kind of create that shared alignment and understanding. And, in that process also, I think we intensely worked at a country level with each of our interventions to map out the component parts of the interventions and understand how we could use a phased approach to adapt each of the individual components of our interventions to fit within government systems, and then map out a process for transitioning components incrementally over to government ownership for them to scale directly. And I think, as Olivier mentioned, also a key component of this was to decide, which components of this intervention are actually scalable. And it's interesting working in a kind of in a global program that works across different countries. One thing you see, especially in sustainable scale through the public sector, was that we had different levels of decentralization within each of the governments that we were working in, which kind of provided this robust learning opportunity for us. Scaling through the national level in Ethiopia, through state level in Nigeria, through district level in Tanzania. So yeah, there's a lot of, I think, rich learning for A360 that's come out of how your approach to sustainable scale, in particular through the public sector, is different depending on that level of decentralization. So yeah, I think just my general reflections that echo what a lot of the panelists and other individuals who shared have already mentioned. The importance of creating space for pausing and reflecting around the evidence, really concrete planning, there's a real necessity for sort of appropriate context-specific, but also evidence-based tools that can be, used routinely to pursue sustainable scale that's in a measured and thoughtful way. And then for A360 also, because we have a multi-country program, I think creating moments of thought exchange across the portfolio were really useful for us. I think I want to echo, as others have said, we definitely don't have it all figured out. So we appreciate the chance to be transparent about the ways that what we've learned and also the areas where we failed. And having thought partners such as in this working group, I think is really really valuable for us as a program. So appreciate the chance to share some of our learning.
Thanks, Megan. We really appreciate your comments. I think it's especially, important that you mentioned the having time to do pause and reflect and think across with other partners while you're in the process of scale up, and also your call for tools. So I think those are things that are coming up. So I think I have a couple of people who are waiting to speak. So let's see. I think we have someone from Pathfinder Ethiopia. Would you like to go next? I'm not sure how to pronounce your name. Yawandason, over to you.
Thank you. Okay, thank you very much. Good afternoon. My name is Yawandason, and I have worked in Pathfinder almost more than 15 years. And Pathfinder Ethiopia is a major partner for the Ministry of Health of Ethiopia. And we have been involved in major scale-up, national scale-up programs, for example, in Plano scale-up program, in revitalization of ICD program, immediate postpartum family program, and others. And for a successful implementation of a scale-up program, what we did was first we have to understand the capacity of the health system of the public sector so that we can institute different activities for the scale-up program. And not only providing capacity building trainings for service providers is the major intervention. We in a scale-up program, we invest a package of activities, for example, capacity building, and we provide supplies, post-training supplies, and gap filling supplies to ensure initiation of the service immediately after training. And we provide also different guides, working tools, and we also provide them a culture of how to make follow-up review meetings, including to that, we also invest on skill building for health managers and providers also, how to manage program services, how integrate the scale-up program. The lesson learned from this scale-up program, the first one is you have to gain a trust from the public sector and funder. And the scale-up program must include all levels who are involved in the scale-up program. That means at a system level. And we also focused on building the local capacity of the public sector in terms of monitoring, follow-up, how to integrate the scale-up services into the system, including we have learned also the skill building in management of service programs is also an important issue. Finally, what we learned was we have introduced or initiated some intervention which supports the scale-up program. Probably I will answer if somebody asked me. For example, one example, during the Implanon scale-up program, since the health extension workers were only allowed to do Implanon insertions, removals of implants and IUCD and the other family planning services were not possible by the health extension workers. Therefore, we capacitated the health center to do a backup support to travel, a regular travel from the health center to the community so that they can provide the full package of family planning program. That is what I have from my part. Thank you very much. Back to you.
Rebecca, you're muted, sorry.
Sorry about that. I just was thanking you for your remarks and your sharing your experience in Ethiopia with us. And I wanted to turn to someone who's had their hand up for quite a long time. So I think Charles Kabiswa would like to speak. Charles, could you unmute yourself and share your thoughts with us?
Yeah, thank you, Rebecca, and the colleagues who have so far contributed and all the participants. Mine is going to be a brief one. I've participated in a project in Uganda and Kenya, which is integrating population health, and we call it PHE, population health and environment. Those are multi-sectoral kind of interventions, but the project itself is called the health of the people and the environment in the Lake Victoria Basin, which started in 2011 and until around 2018, implemented by a number of multi-sector partners. The project itself was multi-sector, so we had to bring together a number of sectors, organizations working on different sectors, and that is Pathfinder International and a number of conservation partners, but also bringing together the expertise because of the uniqueness of the project. But also the good news, we had a multi-sector funding kind of arrangement where we got funding from USAID and then MacArthur Foundation and then the PACAD. So this covered Uganda and Tanzania. I mean Uganda and Kenya, and we are mainly targeting the Lake Victoria Basin Commission or the Lake Victoria Basin itself. So it was a project where we started planning for scale right from the start, and we had to come up with a number of kind of a minimum package, which we strategically thought would scale up to institutionalization at user organizations, but also at the government level, or of course targeting the regional level. So one of the key, I think I want to mention that we are highly guided by the expanded tools, especially beginning with the end in mind, and even other tools that guided us in the scale. So I must agree with my colleagues, I think Kali and others, who said that scale up can't happen by magic or by accident. So we had to follow this kind of a systematic approach. And this is something that started right from the start. So the question we are not asking why does the pilot project work, but what happens beyond the pilot. So the onset, we had to bring in a number of key stakeholders because we were targeting them in the short and the longer run to be more strategic in terms of carrying it forward. And these are still way across sector stakeholders, which were drawn from population, health and environment sectors, moving from the Lake Victoria Basin Commission to the government at national level, Kenya and Uganda. And then we had to develop a number of tools, and then we went through a process of course, keep the end of scale in mind, right from the design through implementation. And then we developed a scale-up strategy, we implemented it, and also tried to strategically manage the scale-up process. Up to now, the project ended, but we still have a strategic interest to see how it has gone around with especially institutionalization. So just to let you know, we had phases. It was phased. Hope LOVB1, that is phase 1, phase 2, and then the phase 3, which was looking at beyond the pilot. So we registered a number of successes because in terms of our key outcomes of scaling up, we targeted a number of policy frameworks and the plans. Like in Uganda, we target the climate change policy, the local development plans, and the Uganda family planning costed implementation plan. But also because this was more multi-sector, we had to get to identify a focus kind of government agents that was in neutral, and in our case, this was the National Population Council, which supported the coordination of all the population health and environmental coordination work, since it was cross-sector, we couldn't align it into only one ministry. So we are, to date, we have kind of institutionalized it in Uganda, especially by having the population health and the environmental integrated into the National Population Strategic Plan up to 2026. And this has been running for the past 2 years. We also have the National Development Plan 3 having an integration of the same as well. And then we've got so many new user organizations, over 10 of them running over 10 projects which are integrating population health and the environment. And also we have also tried to bring new funding streams and the partners for PhD work in Uganda and East Africa on board. But also we see universities also trying to integrate population health and environment courses into the curriculum. But also at the regional level, already I've told you that we were targeting the East African community under the East African Lake Victoria Basin Commission. We have the East African PHE strategic plan, and also the Lake Victoria Basin Population Health and Environmental Operation Plan, and quite a number of others, and PHE training modules, the minimum package. There's a lot of evidence which we generated to inform advocacy. But just to summarize, is again focusing more the institutionalization is where we now have the government of Uganda funding the population health and environmental work within the National Planning Authority, but through the National Population Council, and then the ongoing momentum whereby the National Population Council is coordinating the civil society and also the government line ministries to come together, which is again funded by the government. So these are great attributions. And for me, it is a kind of a proof of concept that if you follow kind of more of a systematic approach, you can actually get this better. So the question would not be what happens beyond the scale up. It should be, does the pilot project work? So that early planning from start and looking at continuing seeing pilots as building blocks. So I must agree with the rest of my colleagues. I think a lot of things are a bit similar, but maybe there's also a lot of documentation that we've brought forward, and they can always be accessed. I think that's briefly what I can share because of time, and we will see maybe need more to converse if maybe offline as well. Thank you so much. And sorry, I was fast. So, but
you're great. Thank you, Charles. I really, and I'm sure we all really appreciate this back and forth between higher level kind of principles, theories, approaches to scale up, and then the detailed explanations many of you have been sharing now about how this looks in like real time in action. So I think it's very enriching to share those two perspectives. So we're nearing the end of our time together. So I know many of you would probably like to share and have a lot of more ideas. So I think the best solution to that is to continue participating in our community of practice and come to the next meetings. We can keep sharing, keep working on this together on how to really make sure we're infusing a scale-up perspective in our organizational, in our work. So I want to first thank all of you who just shared, as well as Callie, David, and Olayinka, who got us started and really kick-started such a rich conversation, and pull out a couple of key themes before we kind of wrap up the day. So I noted as you were chatting some of the themes that kept coming up during our conversation. And one thing that was very interesting to me is that a lot of the reflections, best practices, lessons learned are applicable to our own organizations and our own work, as well as the work we do with partners, governments, communities on the ground. So maybe made me think in a little different way, and that some of these scaling up principles apply, internally and also in our work externally. So with that lens, here are some of the lessons learned. So first of all, have a vision. So we need to have a shared vision that explicitly addresses scale up, what scale up means, what's our purpose. And there was some chat going on about what's the spirit of scale up. So it's not just the letter of scale up, or yes, we're all agreeing to do scale up, but what does that really mean as a vision and a purpose in our own organizations and working with our partners? And that leads to ownership, who does and who pays. So really paying attention to who owns, this work that we're doing, and that, to me, that's part of having a vision, and also part of having what sometimes we've called it different things on here, but really today, sort of a theory of change, a hypothesis. What are our pathways to scale? We heard a lot of discussion about how it's important to have that in your proposal and your plans from the beginning, that it should be iterative. It's a living thing that gets evolved over time. So almost everyone who spoke talked about the importance of having a framework and tools that we can explicitly apply to scale up. So we've got our vision, we own it, and we have a theory or a roadmap of how we're going to get there. Then you also discussed we have to have a scale up mindset, and that's sort of the heart behind the vision and the theory of change. And that can be threatening sometimes, when it means you might be threatening your country office's existence, our own roles, our jobs, really looking differently at our role in terms of imposing or incorporating a scale-up mindset in our work. And then I really appreciate be practical. So scale-up doesn't happen by magic. It's not some complicated, technical thing. It's really practical. So is my intervention scalable? Have we made those hard decisions to make sure what we're trying to do is scalable? Do we have measures for scale up? Do we have a plan for how it's going to happen? Do we have a budget, et cetera? So really making sure that we're being practical about scale up. And then the last kind of theme that was coming up towards the end, which I think is really important, is all about shared learning, pause and reflect, adaptive management, meeting with our stakeholders and partners to think about how well scale up is going, what shifts we need. And I think that's really a building block of all of these other things you've raised: the shared vision, the theory of change, the scale up mindset, and being practical. So that all happens within the context of us getting together, talking, reflecting, and acting, gathering information and acting on our reflection. So with that, I wanted to plug, or at least just kind of foreshadow, a new activity that we're working on in ExpandNet, which is a scale-up learning center. So we're just starting to think about it. It will be an online learning site with resources, training, videos, opportunities to connect. So if you can all just start thinking a little bit about that, and maybe let us know offline or via chat if you feel that would be helpful, what you'd like to see on an online training center from ExpandNet, that would really help us as we kind of shape the way forward on this. So thank you all for participating, listening to me, and to our great panelists and participants. And I'd like to shift it over to Laura for some closing remarks.
Yes, thank you so much, Rebecca, and all of our speakers from around the world. It was just so wonderful to hear your experience. And of course, in an hour and a half, we can only scratch the surface of the content that we're trying to tease out today. But we all have a lot of work ahead, it's clear, and some of us are further along this pathway than others, and it's our duty, our obligation to help everybody kind of move in this direction, because the topic of mainstreaming a scaling up mindset is one that ExpandNet and the community of practice, we all believe that this is the way forward for global health. We want to support this as much as we can. Rebecca is sharing how ExpandNet is thinking about this for the next several years of work, and the community of practice really wants to take up this issue of mainstreaming the scaling mindset as a community for the next 1 to 2 years. So your input today will definitely help shape how we think about that and move ahead. So please, as Rebecca said, be warmly invited to continue participating in these discussions with the community in the context of the Health Technical Working Group, but also the other working groups and the community writ large. So before I let you go, I want to encourage everybody to participate in the final, besides the other working groups, but also the final closing plenary, which will take place a week from today, where we will be discussing a paper by Johannes Lin and Richard Cole that lays out a set of principles that should ideally guide scaling up. And the plenary will be in 2 parts. First, the paper will be reviewed, or will be presented and then reviewed by our esteemed panel. and then discussed by all of you, hopefully, in the chat and otherwise. And that will then be followed by a session on charting the course for the community of practice in the years 22 and 23. So please join us, please stay with us and stay engaged. And many, many blessings to everybody. Thank you so much for the time, and please take good care. And bye-bye for today.